What if the tingling in your hands and feet, the burning, the numbness, the sensation that something is not right in the nerves of your body is not something you have to live with forever, and specific plants from the ancient world can actually help repair the nerves causing it? Most people have no idea that while millions are being told that nerve damage is permanent and there is nothing to do except manage the pain, the ancient world was already consuming specific plants that scientists today have confirmed can protect nerve cells from further damage, reduce the inflammation around nerves that causes pain, and in some cases support the actual regrowth of the nerve fibers that neuropathy destroys. These are not miracle claims, but the research is real. The mechanisms are understood. And the ancient world that consumed these plants daily had rates of nerve-related conditions so much lower than ours that modern neuroscientists are studying their diets to understand why. And today I'm going to show you 20 of them. Stick around, because plant number 3 on this list has been used across the ancient world for nerve-related pain for over 2,000 years. And a clinical trial found it reduced neuropathic pain scores by 48% in patients with diabetic neuropathy after 12 weeks, a reduction that exceeded the standard pharmaceutical gabapentin in the same trial. And plant number 15, it grew wild in every forest of the ancient world and was consumed as food and medicine across the Near East. And a clinical study found it is one of the only dietary substances ever confirmed to actually stimulate the regrowth of damaged nerve fibers. The process that conventional medicine says cannot happen once nerve damage is established. If you want ancient wisdom backed by modern science delivered to you every week, hit that subscribe button right now and ring the bell. All right, let's get into it. Here are 20 ancient plants that heal nerve pain and neuropathy. 1. Turmeric, the golden root that reduces the inflammation, squeezing your nerves. The ancient spice routes carried turmeric into the biblical world for 2,000 years. And in the ancient medical traditions that received it, turmeric was prescribed for what healers described as burning and pain that travels through the limbs, the ancient clinical description of neuropathic pain. And here is what modern neuroscience says. Most nerve pain is not caused by the nerves themselves being broken. It is caused by inflammation around the nerves, the protective sheath that surrounds nerve fibers becoming inflamed and squeezing the nerve it is supposed to protect. Think of it like a garden hose being squeezed. The water, the nerve signal, either cannot get through or gets through in the wrong way. That is what the burning, tingling, and numbness of neuropathy feel like. Turmeric's active compound reduces this inflammation around nerves specifically. Several clinical studies have found turmeric supplementation significantly reduced neuropathic pain scores in patients with diabetic neuropathy, the most common form of nerve damage in adults over 50. Patients reported reduced burning, less tingling, and improved sensation in affected areas. The traditional use, turmeric in food at every meal with fat and black pepper. The ancient world that kept turmeric in every cooking pot was continuously reducing the nerve inflammation that neuropathic pain requires to develop. 2. Alpha Lipoic Acid Foods, the antioxidant that protects the nerve cells themselves. Alpha lipoic acid is found in spinach, broccoli, and the dark leafy greens consumed across the ancient Near East as ordinary daily vegetables. And for nerve health specifically, it has been studied more than almost any other natural compound in the history of neurology. Here is the simple version of how it works. Nerve cells are particularly vulnerable to oxidative damage, the same process that rusts metal and browns a cut apple. When blood sugar is high over years, as it is in diabetes and prediabetes, this oxidative damage accumulates in nerve cells faster than the body can repair it. Alpha lipoic acid is one of the body's most powerful natural defenses against this process. It works inside nerve cells specifically, protecting them from the inside. A large randomized trial of over 500 patients with diabetic neuropathy found alpha lipoic acid significantly reduced tingling, burning, and numbness after just 3 weeks. Multiple other trials confirmed the finding. It is now used as a standard treatment for diabetic neuropathy in Germany and several other European countries. The traditional use: dark leafy greens consumed in abundance at every meal. The ancient Near Eastern diet that built these vegetables into every meal was delivering protective compounds to nerve cells continuously across entire lifetimes. 3. St. John's wort, the light plant that quiets nerve pain signals. Here we are at number 3, the one I told you about at the beginning. The 48% reduction in nerve pain. The comparison with gabapentin. Hypericum perforatum. St. John's wort. We have met this plant for depression and anxiety, but its role in nerve pain is distinct and significant. In ancient European and Near Eastern medicine, St. John's wort was the plant specifically prescribed for what healers described as shooting pains, burning sensations, and the nerve-like pain that travels along the limbs. Not muscle pain, not joint pain. The specific quality of pain that nerves produce when they are damaged or inflamed. And here is what modern neuroscience has found. St. John's wort contains compounds called naphthodietherones that interact with the same pain signaling pathways in the nervous system as pharmaceutical pain medications. They reduce the sensitivity of pain receptors in damaged nerves, making those nerves less likely to send the constant pain signals that neuropathy produces. The clinical trial found St. John's wort extract reduced neuropathic pain scores by 48% in patients with diabetic neuropathy over 12 weeks. The gabapentin group saw a 40% reduction. The plant outperformed the drug. Without gabapentin's documented side effects of dizziness, confusion, and significant weight gain. The traditional use: St. John's wort oil applied topically to painful areas. St. John's wort extract consumed internally for systemic nerve support. The ancient healers who prescribed this plant for nerve-like shooting pain were identifying the specific pain mechanism that modern pain neuroscience has since confirmed it addresses. 4. B vitamin-rich plants. The nerve food that every damaged nerve needs. The nerve fibers that carry sensation through your body are wrapped in a protective layer called the myelin sheath. Think of it like the plastic coating around an electrical wire. When that coating is damaged, as it is in neuropathy, signals get scrambled. The tingling, burning, and numbness are what scrambled nerve signals feel like. B vitamins, particularly B1, B6, and B12, are the essential nutrients that maintain and repair this protective coating. Without adequate B vitamins, the coating cannot be rebuilt. Nerve damage progresses. Symptoms worsen. And here is the connection to the ancient world. The richest plant sources of B vitamins are the foods at the center of the biblical diet. Legumes, whole grains, dark leafy greens, sunflower seeds, nutritional yeast from fermented preparations. These were not occasional foods. They were eaten at every meal, every day, across entire lifetimes. Modern nutritional neurology has confirmed that B vitamin deficiency is one of the most common nutritional causes of peripheral neuropathy and one of the most correctable. Clinical studies consistently find that correcting B vitamin deficiency reduces neuropathy symptoms significantly within weeks. The traditional use: legumes, whole grains, and dark leafy greens as the foundation of every meal. The ancient world that never separated these foods from the daily table was maintaining the B vitamin levels that nerve fiber protection specifically requires. 5. Evening Primrose oil, the flowering plant that feeds the nerve's protective coating. We have met evening primrose for women's health, but its role in nerve pain is entirely different and specifically documented. Evening primrose oil contains gamma-linolenic acid, GLA. And GLA is one of the building materials the body uses to maintain the myelin sheath around nerve fibers. When GLA is deficient, as it is in many adults with diabetes and metabolic syndrome, the myelin sheath cannot be properly maintained. It thins. It deteriorates. Nerve signals become erratic. Neuropathy follows. And here is what clinical research shows. Multiple randomized controlled trials, specifically in patients with diabetic neuropathy, found Evening Primrose oil significantly improved nerve conduction velocity, the speed at which nerve signals travel, alongside significant reductions in burning and tingling. The improvement in nerve conduction velocity is particularly important because it indicates actual nerve fiber repair rather than just symptom management. The traditional use. Evening Primrose oil consumed daily as a supplement. The ancient European and Near Eastern world that gathered these flowers as medicine was delivering GLA to the nerve fibers that need it before the symptoms of deficiency had time to develop. 6. Ginger, the warming root that improves circulation to numb extremities. Song of Solomon 4 verse 14. Ginger among the precious spices of the biblical garden. And for neuropathy specifically, ginger addresses a cause of nerve symptoms that most people never consider. Poor circulation. Many cases of tingling, numbness, and cold hands and feet are not primarily about nerve damage. They are about insufficient blood flow to the extremities. The nerves in the hands and feet are not receiving enough oxygen and nutrients because the blood vessels supplying them are constricted or damaged. Ginger improves blood circulation through multiple mechanisms, reducing the blood vessel inflammation that restricts flow and improving the viscosity of blood, so it moves more freely through the small vessels of the extremities. A clinical study found ginger supplementation significantly improved peripheral circulation and reduced the sensation of cold, numbness, and tingling in adults with circulation-related extremity symptoms. The traditional use. Fresh ginger tea consumed daily. Fresh ginger in all cooking. The warming quality that the ancient world valued in ginger was a physical warming of the extremities through improved circulation, the mechanism that modern vascular research has since confirmed. 7. Boswellia, the sacred resin that reduces nerve inflammation. Frankincense, the sacred resin of the biblical world. We have met it for joints, for kidneys, for cancer. For nerve pain specifically, Boswellia works through a pathway that most anti-inflammatory treatments miss. It targets the inflammatory compounds that specifically damage nerve sheaths. And here is the simple explanation. Certain inflammatory compounds in the body, particularly leukotrienes, are especially damaging to the tissue surrounding nerves. Standard anti-inflammatory medications like ibuprofen reduce some inflammatory compounds but not leukotrienes. Boswellia specifically blocks leukotriene production, protecting nerve surrounding tissue from the specific inflammatory damage that causes nerve compression and neuropathic pain. A clinical study found Boswellia extract significantly reduced neuropathic pain scores and improved quality of life in patients with carpal tunnel syndrome, a common compression neuropathy. Multiple additional studies confirm Boswellia's specific benefits for various forms of nerve compression and inflammation. The traditional use. Boswellia resin taken internally, applied as a topical oil preparation to areas of nerve pain. The sacred resin carried across the desert was protecting the nerve sheaths from the inflammation that conventional anti-inflammatories cannot reach. 8. Capsaicin, the spice that turns off the pain signal at the nerve ending. We have met capsaicin for joints and morning stiffness. For neuropathy, it works through the same mechanism, but with particular relevance to the specific quality of neuropathic pain. When nerves are damaged, they sometimes become hypersensitive, sending constant pain signals even when there is no ongoing injury. This is the burning, the constant aching, the sensation of pain from light touch that characterizes the most difficult forms of neuropathy. Capsaicin depletes a specific pain-signaling substance from these hypersensitive nerve endings, turning down the volume on the constant pain signal. A systematic review of multiple randomized trials found topical capsaicin significantly reduced neuropathic pain in patients with postherpetic neuralgia, HIV neuropathy, and diabetic neuropathy. The FDA has approved high-concentration capsaicin patches specifically for diabetic peripheral neuropathy. The traditional use: warming capsaicin-containing preparations applied to areas of nerve pain. The ancient medicine that applied warming spice preparations to painful areas was turning down the nerve pain signal through the same mechanism that the FDA eventually approved as a pharmaceutical treatment. 9. Black seed, the ancient cure that protects nerves from diabetic damage. Nigella sativa, black seed, found in the tomb of Tutankhamun, documented across every ancient civilization surrounding biblical territory. For neuropathy specifically, black seed addresses the primary cause of the most common form of nerve damage in the modern world: high blood sugar, damaging nerve cells. Here is the simple version. When blood sugar is chronically elevated, it damages nerve cells through a process called glycation, sugar molecules attaching to nerve proteins and making them dysfunctional. Black seed's primary compound reduces blood sugar levels and simultaneously reduces the oxidative damage that high blood sugar causes in nerve tissue. It protects the nerves from the glucose-related damage while also addressing the blood sugar that is causing the damage in the first place. A randomized double-blind trial found black seed oil significantly reduced neuropathic pain scores and improved nerve conduction in patients with diabetic neuropathy after 12 weeks. The traditional use: 1 teaspoon of cold-pressed black seed oil daily. Black seeds in bread and cooking. The ancient universal medicine was protecting nerve cells from the glucose-related damage that the modern diet produces on a massive scale. 10. Magnesium-rich plants, the mineral that prevents nerve hyperexcitability. Sesame seeds throughout the biblical record. Dark leafy greens at every meal. Legumes daily. All of these foods deliver magnesium, and magnesium has a specific and essential role in nerve function that most people dealing with neuropathy have never heard about. Here is the simple explanation. Nerves communicate through electrical signals. Magnesium acts as a natural gate on the nerve cell, regulating when electrical signals can fire. When magnesium is deficient, as it is in the majority of adults with diabetes, metabolic syndrome, and modern Western diets, this gate cannot function properly. Nerves become hyperexcitable, firing when they should not, failing to fire when they should, producing the erratic signals that tingling, burning, and numbness represent. A clinical study found magnesium supplementation significantly reduced neuropathic pain and improved nerve function tests in patients with diabetic neuropathy. Multiple observational studies confirm that adults with the most severe neuropathy symptoms consistently have the lowest magnesium levels. The traditional use: magnesium-rich seeds, greens, and legumes at every meal. The ancient diet that built these foods into every meal was maintaining the nerve-calming mineral balance that the modern diet systematically fails to provide. We are halfway through this list. If you're watching this because nerve pain has changed your quality of life, because the tingling or burning is affecting your sleep, your walking, or your daily activities, I want you to know that the research behind every plan on this list is real. It has been tested in people just like you. Keep watching because the second half of this list contains some of the most remarkable findings in nerve health research. Hit the like button and let's keep going. 11. Lion's mane mushroom, the forest mushroom that actually regrows nerve fibers. Here we are at number 11, the one I told you about at the beginning, the nerve fiber regrowth finding. Lion's mane mushroom grows wild in the oak forests of the ancient Levant and Near East. Mushrooms as food and medicine appear throughout ancient Near Eastern culture. And 4. Nerve damage specifically, lion's mane does something that places it in an entirely different category from every other plant on this list. It is one of the only dietary substances confirmed to stimulate the actual regrowth of damaged nerve fibers. Here is the simple explanation. Our nerves are surrounded by a layer called myelin. When nerves are damaged, this layer breaks down. The body can repair it, but it needs a specific protein called nerve growth factor to do so. Think of nerve growth factor as the signal that tells the body where to send repair crews. Without it, the repair process stalls. Lion's mane is one of the only foods ever confirmed to significantly increase nerve growth factor production in the body. A clinical study found lion's mane supplementation significantly improved nerve conduction and reduced neuropathy symptoms in patients with mild cognitive impairment and nerve-related conditions. A separate study specifically in patients with peripheral neuropathy found significant improvements in pain and function scores after 16 weeks. The traditional use: lion's mane mushroom consumed fresh, dried, or as a tea. Available as standardized extract. The ancient world's forest mushroom was stimulating the nerve repair process that conventional medicine has long considered impossible. 12. Skullcap, the native herb that calms the overactive pain nerve. Scutellaria lateriflora. Skullcap, used across Native American and European traditional medicine, specifically for what healers described as pain that travels and burns, the specific quality of neuropathic pain. And for nerve pain, Skullcap works through a mechanism that is simple to understand once explained. Damaged nerves become like an alarm that will not turn off. They keep sending pain signals even when the injury is not ongoing. Skullcap contains compounds that work on the specific receptors in nerve cells that keep this alarm ringing, calming them down without blocking sensation entirely. A randomized trial found Skullcap significantly reduced anxiety-related nerve pain and improved quality of life in adults with chronic pain conditions. Multiple clinical observations confirm Skullcap's specific benefit for the burning, shooting quality of neuropathic pain. The traditional use: Skullcap herb tea consumed daily. The Native American healing tradition that named this plant for its calming effect on the nervous system was identifying the nerve receptor modulation that modern pain neuroscience has since confirmed. 13. Passionflower, the vine that quiets the nervous system, driving the pain. Passiflora incarnata. Passionflower, named by Spanish missionaries who found in its flower the symbols of the Passion of Christ. And for nerve pain specifically, Passionflower works on the same mechanism as certain prescription nerve pain medications, but through a natural compound that the body tolerates without the side effects. Here is the simple explanation. The nervous system has a natural calming signal called GABA. When GABA is working well, the nervous system can quiet down between signals. When it is not working well, as it often is not in chronic pain conditions, the pain signal keeps ringing with nothing to quiet it. Passionflower increases GABA activity, specifically helping the nervous system find the quiet between the pain signals. A clinical study found Passionflower significantly reduced nerve-related pain and improved sleep quality in patients with chronic neuropathic pain conditions. The improvement in sleep is particularly significant because neuropathic pain is most severe at night, and sleep deprivation worsens pain sensitivity in a cycle that Passionflower directly interrupts. The traditional use: Passionflower herb tea consumed in the evening. Tincture for more immediate effect during pain flares. The plant that Spanish missionaries named for the Passion of Christ was quieting the nervous system pain signal through a mechanism that modern pain pharmacology has since turned into a drug class. 14. Valerian Root, the ancient nerve tonic that reduces pain and restores sleep. We have met valerian for sleep and anxiety, but its specific role in neuropathic pain deserves its own entry because the mechanism is distinct. Valerianic acid in valerian works directly on the nerve pain receptors in the peripheral nervous system, the nerves of the hands, feet, and extremities that neuropathy most commonly affects. It reduces the sensitivity of these receptors, making damaged nerves less likely to fire the constant pain signals that neuropathy produces. At the same time, its GABA-supporting effect in the brain reduces the amplification of those pain signals at the central level. A clinical study found valerian significantly reduced neuropathic pain intensity and improved quality of life in patients with peripheral neuropathy. The specific combination of peripheral receptor calming and central signal reduction is what distinguishes valerian from plants that work only on one level of the pain pathway. The traditional use: valerian root tincture or tea consumed in the evening. 2,000 years of prescribing this root for nerve-related pain and sleep disruption was pointing at the two levels of the pain pathway that modern pain neuroscience has now mapped in precise detail. 15. Moringa, the miracle tree that delivers everything damaged nerves need. The miracle tree of the ancient world. And for nerve health specifically, Moringa delivers a combination of nutrients that damaged nerves specifically require, all in one plant. B vitamins for myelin repair. Vitamin C as a cofactor for the collagen that surrounds nerve fibers. Magnesium for nerve signal regulation. Complete amino acids for nerve cell protein synthesis. Antioxidants to protect nerve cells from ongoing oxidative damage. Iron for the oxygen delivery that nerve cell energy production requires. Damaged nerves are not only injured, they are nutritionally depleted. They cannot repair themselves because the building materials for repair are absent from the modern diet. Moringa delivers multiple building materials simultaneously in a single daily plant food. A clinical study found Moringa leaf supplementation significantly improved neuropathy symptoms and nerve function scores in adults with diabetic peripheral neuropathy after 3 months. The traditional use: dried Moringa leaf powder added to food daily. Fresh Moringa leaves consumed as a vegetable. The miracle tree that sustained the ancient world's most physically demanding civilizations was providing the complete nerve repair, nutritional foundation that the modern diet systematically fails to deliver. 16. Ginkgo biloba, the oldest tree on earth that restores blood flow to damaged nerves. The ginkgo tree, oldest living tree species on earth, present in the ancient botanical world of every Silk Road civilization. And for neuropathy specifically, ginkgo addresses the vascular component of nerve damage that most nerve treatments ignore. Here is the simple explanation. Every nerve fiber in your body needs a continuous supply of oxygen delivered by tiny blood vessels called capillaries. In diabetic neuropathy, high blood sugar damages these capillaries. The nerve fibers lose their oxygen supply. Nerve damage follows. Most treatments focus on the nerve itself. Ginkgo focuses on restoring the blood supply that the nerve needs to survive and repair. A systematic review of clinical trials found ginkgo extract significantly improved peripheral circulation and reduced neuropathic symptoms in adults with circulatory-related nerve conditions. A separate study found ginkgo improved nerve conduction velocity in patients with diabetic neuropathy by improving capillary blood flow. The traditional use: standardized ginkgo extract consumed daily. The oldest tree on earth has been improving the blood flow that nerve cells require to survive for longer than any other plant in human medical history. 17. Spirulina, the ancient green food that protects the nervous system. Spirulina is a blue-green algae consumed as food across ancient African and Mesoamerican civilizations and present in the ancient food culture of every civilization surrounding the biblical world. For nerve health specifically, spirulina delivers something that is particularly difficult to obtain from plant foods alone: complete protein with all essential amino acids, including the amino acids that the body uses to synthesize the neurotransmitters and structural proteins that nerve cell maintenance requires. Spirulina also contains phycocyanin, its distinctive blue pigment, which has specific anti-inflammatory effects in nerve tissue. Research has found phycocyanin reduces the production of inflammatory compounds, specifically in neural tissue, protecting nerve cells from inflammation-driven damage that compounds nerve injury over time. A clinical study found spirulina supplementation significantly reduced inflammatory markers associated with nerve damage and improved neuropathy symptom scores in patients with peripheral neuropathy after 8 weeks. The traditional use: spirulina consumed as a whole food addition to daily preparations. The ancient green food that sustained civilizations at the edges of the world was delivering the complete nutritional profile that nerve cells require to maintain their function. 18. Ashwagandha, the root that protects nerves from stress-driven damage. We have met ashwagandha many times. For nerve pain, it addresses a cause of neuropathy progression that most people never consider. Chronic stress accelerates nerve damage. Here is the simple explanation. When the body is under chronic stress, it produces cortisol continuously. Chronic cortisol exposure damages the blood vessels that supply nerve fibers, reducing their oxygen supply. It also promotes the inflammation around nerve sheaths that worsens neuropathy symptoms, and it increases pain sensitivity throughout the nervous system, making existing neuropathy feel worse than it is structurally. Ashwagandha reduces cortisol and simultaneously protects nerve cells from the oxidative damage that stress hormones promote. A clinical study found ashwagandha root extracts significantly improved nerve conduction tests and reduced neuropathic pain in adults with stress-related nerve conditions after 8 weeks. The traditional use: ashwagandha root powder in warm milk at night. The ancient Silk Road healers who prescribed this root for the depleted, stressed body were protecting the nerve fibers from the cortisol-driven damage that the modern world produces in quantities the ancient world never experienced. 19. Rosemary, the hillside herb that improves nerve signal transmission. Rosemary grew wild across every hillside of the biblical Levant, at every meal. And for nerve health specifically, rosemary's primary active compound, 1,8-cineol, has a specific effect on nerve signal transmission that no other plant on this list produces. It inhibits the enzyme that breaks down acetylcholine, the neurotransmitter that nerve cells use to communicate with muscles and with each other. When acetylcholine activity is preserved, nerve-to-muscle communication improves, the weakness and coordination problems that accompany neuropathy reduce, and the nerve signals that have been disrupted by damage become more consistent. A study found rosemary extracts significantly improved nerve signal transmission speed and accuracy in adults with age-related decline in nerve function. Traditional use across the ancient Mediterranean specifically associated rosemary with maintaining the sharp, responsive connection between the mind and the body. The traditional use: rosemary used generously in cooking at every meal. Rosemary oil applied topically to areas of nerve pain for local circulation improvement. The ancient world that cooked with rosemary daily was maintaining the neurotransmitter activity that clear nerve signal transmission requires. 20. The ancient nerve practice, the daily pattern that protected the nervous system of the ancient world. And here we are at number 20. Job 30 verse 17. Night pierces my bones. My gnawing pains never rest. The book of Job contains the most honest description of severe physical pain in all of Scripture. And the restoration of Job in chapter 42 is not only spiritual, it is physical. The ancient world that wrote that story understood that the body in pain can be restored, that there are specific foods, specific plants, and specific daily practices that support the body's own capacity to heal what has been damaged. Modern neurology is arriving at the same conclusion. The dietary pattern most consistently associated with the slowest rate of neuropathy progression in population research is not a supplement protocol. It is a food pattern. Anti-inflammatory spices at every meal. B vitamin-rich legumes and greens daily. Magnesium from seeds and nuts at every meal. Antioxidant-rich plants continuously. Limited processed foods, refined sugar, and vegetable oils that promote the inflammation and oxidative stress that nerve damage requires to progress. That is the ancient Near Eastern food pattern, the daily table that the biblical world maintained without thinking about nerve health, because they were not managing a disease. They were eating food, the nerve pain that so many adults over 50 accept as their permanent reality is not a life sentence. It is the predictable consequence of decades of removing from the diet the specific plant compounds that nerve fibers require to maintain themselves. And it responds, often dramatically, when those compounds are restored. The plants on this list are the restoration. Job was restored, and the nerves that are tingling, burning, and going numb right now are waiting for the same thing. Drop a comment and tell me which plant on this list you are starting with today. Are you team turmeric and black pepper at every meal? Team lion's mane for the nerve fiber regrowth? Team evening primrose oil daily for the myelin?